This is a quick one. It's called Unassigned Provider. It was initially created for people working in urgent care settings or in the emergency room where patients show up and the provider is not known at the time of appointment. Patients queue up and you may have some providers and they take the patients as they come. There's two ways to get .unassigned to show up on your appointment list in that clinic. One way is in CHCS, just appoint the patient without the provider block filled in. So for the provider, it'd be blank. And when the appointment comes over to AHLTA, it'll automatically show up as a .unassigned patient. The other way is if you have a walk-in clinic and a patient shows up, just click the New Appointment button, search for the patient. We'll type in SORAS, say OK. Up in the top corner where it says Provider, there's a .unassigned provider. Select that, and that patient will show up on the list as a .unassigned. Now, another thing we did in the workflow, which only applies to people with signing rights, is if you double-click on this patient to open the chart, you'll get a box that asks you if you want to make yourself the primary provider for this appointment, either yes or no. The old way to do it was to do a transfer to yourself, find yourself, and hit OK. Now you could just double-click, the box will pop up, we say yes, then the system will automatically transfer that patient to you, and you could sign the encounter. One last thing I'd like to add is the change selections for the appointment filter. If you look carefully, .unassigned shows up as one of the providers. So if you're in a clinic, for example in the emergency room, you might want to show all for this clinic, and .unassigned will show up on the list. If you just like to see yourself, then you will not see .unassigned. And if you say selected providers, you could select yourself and the unassigned provider, and then set them as your default.